Rebound therapy is the use of the trampoline to provide opportunities for enhanced movement patterns, therapeutic programs, exercise and recreation for a wide variety of people with additional needs. The use of the trampoline has effects on a number of body systems. This includes the cardiorespiratory system and also changes in the neurological system with respect to muscle tone, postural control and balance. With rebound therapy, you're using the physical properties of the trampoline to achieve an effect on the child or young person. So the physical properties that we use are weightlessness, increased and decreased weight as well. You've got acceleration and you've got deceleration with the trampoline bed, and then you've got uneven surfaces which challenge balance. In a typical session, the session will begin by transferring the child or young person onto the trampoline using the appropriate methods, so either a sling and a hoist, or some young people are able to climb onto the trampoline using steps themselves. So there's a variety of things that we're working on while the young person is on the trampoline. We can be working on sitting balance, and that's good in terms of challenging their core strength and improving their sitting balance. The other thing that we can work on is head control, turning from side to side with your head while you're on the trampoline, either in a lying position or a sitting position. And for some young people, just doing some bouncing and standing is quite a challenge and really challenges the muscles that they use for standing to improve strength, and it can help with their balance as well. With our young people, we tend to have to use some supportive equipment, wedges, rolls, things like that, to provide the appropriate physical support for the young person while they're on the trampoline. The other thing that we use quite a bit when we're on the trampoline is songs. Songs tend to give direction to a session, and certainly if a young person has a favourite song, it's a great way to engage them in the session and to get them more involved. It tends to make them more active physically as well, because it's something they're used to hearing and something that really peps them up a bit. One young person who came to us and was not able to bounce in standing, they had very low resting muscle tone, and after a few months of working on the trampoline with us, they were able to progress from sitting and bouncing to standing and bouncing, and at the same time that this happened, their communication skills came along as well. They weren't using any cane and Barry on-body signs when they came and started rebound therapy, and after those few months were up, they were using the sign for more, so requesting more bouncing. They were using the sign for stop, and even using the sign for music and singing to encourage us to sing their favourite song. For the young people that have been coming to rebound therapy with us, it's been really great to see the enjoyment and the freedom that they get by being on the trampoline.